Micronutrients protect you from COVID-19. In this video we discuss the micronutrients that will protect you from COVID-19 and other viral respiratory infections, and in a moment we shall reveal how much of each micronutrient to take every day. Subscribe, click the bell icon and select all notifications, so that all future videos that will transform your health, you will receive them. On the American National Institutes of Health website, we discovered a research that shows that certain micronutrients shield you from COVID-19. The study is titled, The Coronavirus Disease, COVID-19, a Supportive Approach with Selected Micronutrients. It was published in the International Journal for Vitamin and Nutrition Research in January 2021. Worldwide, the pandemic of COVID-19 spreads rapidly and has had an enormous public health impact with substantial morbidity and mortality, especially in high-risk groups, such as older people and patients with comorbidities like diabetes, dementia or cancer. Although there are several vaccines against COVID, new variants are emerging that make current vaccines less effective. There is an urgent need to find supportive therapies that can stabilize and boost the immune system and can help to deal with the infection, especially for vulnerable groups such as the elderly. This is especially relevant for our geriatric institutions and nursing homes. A major potential contributing factor for elderly is due to their high incidence of malnutrition, up to 80% among the hospitalized elderly. Malnutrition results when adequate macronutrients and micronutrients are lacking in the diet. Often missing in public health discussions around preventing and treating COVID-19 patients are nutritional strategies to support optimal function of their immune system. This is surprising, given the importance that nutrients play a significant role for immune function. Several micronutrients, such as vitamin D, retinol, vitamin C, selenium and zinc are of special importance supporting both the adaptive and innate immune systems. As suboptimal status or deficiencies in these immune-relevant micronutrients impair immune function and reduces the resistance to infections, micronutrient deficiencies should therefore be corrected as soon as possible, especially in the elderly and other vulnerable groups. According to epidemiological, experimental and observational studies, some case reports, and a few intervention studies, the supplementation of vitamin D and/or zinc are promising. The multiple anti-inflammatory and immunomodulatory effects of vitamin D could explain its protective role against immune hyperreaction and cytokine storm in patients with severe COVID-19. A randomized, placebo-controlled intervention study even shows that high-dose vitamin D supplementation promotes viral clearance in asymptomatic and mildly symptomatic SARS-CoV-2 positive individuals. Besides, the data of a recent prospective study with COVID-19 patients revealed that a significant number of them were zinc deficient. The zinc deficient patients had more complications, and the deficiency was associated with a prolonged hospital stay and increased mortality. If you want to boost your micronutrient range to protective levels, then these are the parameters you have to achieve. 1. Vitamin D3, 2000 to 4000 IU per day. 2. Vitamin A, retinol, 2000 to 4000 IU per day. 3. Vitamin C, 1000 to 3000 milligrams per day in divided doses. 4. Selenium, 100 to 200 micrograms per day of sodium selenide or selenomethionine. 5. Zinc, 10 to 20 milligrams per day. Thus, immune-relevant micronutrients may help to increase the physiological resilience against COVID-19. You can't depend on your diet to supply these levels of micronutrients, so you need to take supplements. Click the link below to read the full article.